Good evening, everybody. Hi, welcome back. So happy to have you on our Monday night travel chats. As you see tonight, we have a guest, Amanda, not really a guest, part of the family, but Amanda is from our Global Connect team, and that is our clinical line. So if you've called our office and you've heard that option, press, is it 2 now or is it?
We've moved to 3 now.
Okay, all right.
So more people than us.
So press 3 for the clinical line. Amanda's team is the team that you will reach when you choose that option. So Amanda, will you just start by introducing yourself, kind of telling us about your background and who you are here at CNY Fertility?
Yeah, of course. So my name's Amanda. I'm one of the RNs on the Global Connect phone team. I personally split my time between the phones, and I'm also in office 3 days a week. So I love that because I kind of get to be in both places, see things on both ends. And we have a team of about 17 nurses that take your guys' calls throughout the day, all of which are nursing staff. So they've all been trained specifically to be able to handle your calls and take your questions. Myself, I've been with CNY since 2009. I've worn a lot of different hats here. So I've been in the OR, I've been up in the healing arts department. I've been on the clinical ultrasound side, which is kind of where I am now. And then once this phone team kicked off a few years ago, I've been with the phone team too since the beginning. So I've done a lot here. And I just love what we do. So it makes it really easy to enjoy your job when you love what you do.
Absolutely. That's so cool. It's such a long time. And one thing that really strikes me, Amanda, is the longevity with which so many of our nurses have been here.
Yes.
Because I think we all feel very honored to be a part of such a special organization and such a special mission. And like you said, when you love what you do, it's easy and fun and exciting to come to work every day. So that's awesome. Thank you so much for sharing that. Well, tonight, guys, we just really wanted to kind of talk and highlight the ways in which the Global Travel Team works hand in hand in tandem with the Global Connect team. So we think that there's maybe a little bit of confusion about the two different teams. And so we just really wanted to shed some light on the way our two teams work together to help you. And so first, why don't you, Amanda, can you just tell me a little bit more about kind of what the clinical team is there for, what you guys kind of can do, what you can't do, and maybe some of the tips on when might be the right time to call based on what you're calling about.
Of course. Yeah. So like I was saying earlier, our whole team is composed of nursing staff. So we are pretty much able to answer a lot of those clinical questions. We order medications for patients. We can help you book your clinical appointments for your ultrasound, your blood work. We can help you guys get your travel lab recs that you need when you're going to your outside monitoring clinic. We can fax those lab recs for you. We try and do pretty much anything that you guys could need from us. I will admit Mondays and Fridays, just with the rest of the office, are our crazier days. So if you have something that's non-urgent or you want to go over your plan or you need a little extra time for us to help take care of you, I would probably say calling on that Tuesday through Thursday would give you the best time and specialized care to be able to really let us help you and kind of go through things step by step. We can help reiterate those plans. So when you get your call from the travel nurses, they provide us with all of the information. We can see your chart. So, maybe we can't get you right back in touch with that same nurse you were speaking with, but we have everything that we need outlined for you guys. So really, as long as you have your questions written down, ask us. And if we don't know the answer, we'll definitely find it for you.
That's awesome. Yeah, I think that's the biggest point that we're hoping to help all of our clients understand this evening is that our clinical nurses are that. They're all nursing staff. They're all highly trained. Some with what was that, a decade? I won't age you, but a decade plus of experience. And they really are. They're there. They're waiting, and they're ready to help with whatever your question might be. And I think that you make such a good point, Amanda, that the travel team, we know that you have a job, you have a life, you have other things that you may be doing. And so there are going to be plenty of times where we're going to call and you might miss our call. And I know that kind of panicked feeling. I've tried to reach out to my doctors before and I miss them or they miss me, and it feels kind of like I've lost my chance. And I think we really want everyone to understand that that's why we have our clinical line, our Global Connect team, is so that they are there and available when you're you're available, if you need to call back, go over your plan, you have questions, they're here, they're ready. They're waiting for you to kind of help you. Amanda, what would you say is the best way to get in touch with a nurse without having an extended hold time? I know that kind of is a little bit of a hard thing sometimes. So what are your best pieces of advice for that?
Yeah, so we do have a lot of different avenues where you can reach our staff members, not always via the telephone. We have a lot of different teams built into your patient portal. So you have an option to message and web correspond with specific team members. Typically, they get back to you at very most 48 hours, but a lot of times our team works really hard to get back to you, that same day. So if you have some prescriptions that need to be sent through, if you have to change a scheduled appointment, if you decide to change the day where you're going to be monitored, and you basically just need something that we can go ahead and do with you virtually, you do not need to wait and, be in those hold queues that I know can sometimes be 30 to 45 minutes. And we do our absolute best to give you guys all of the time that you need once you get in. But if it's something like that, you can definitely use these other avenues that we have available, as well as the callback feature that we have. As long as you leave a detailed message about what you need and a good contact number to get back to you, we'll definitely get back to you by the time the day is over. It could be up to about 8 p.m. Eastern Standard Time, but we have a lot of nurses that are still here until that time. So we'll definitely get to you if it's a non-urgent matter.
Yeah, absolutely. And just to kind of piggyback on that, I think another good point you mentioned, there's a lot of ways to get in touch with us non-telephonically, just because sometimes those hold times, we are really striving to give everybody the amount of time that they need to kind of feel resolved. So if you do have non-urgent questions that can wait 6, 8, 10 hours or till the next day, feel free to message the travel team directly through the patient portal. So I say this a lot each week, but keep in mind, you may feel tempted to send your questions to the office nursing staff where you're going. So for example, if you're going to Syracuse, you might be tempted to send it to the nursing staff in Syracuse, but do know that our global travel team is here to help for everything that you need leading up to the point where you step foot in one of our offices. And so if it is something non-urgent, absolutely feel free to message through the patient portal. Again, non-urgent. So please don't send us a message through the patient portal about something that you need an answer to right away. That's a time where we really want you to pick up the phone and kind of give us a call. So, moving kind of from that I think sometimes our clients do feel like they get transferred a fair number of times. How can clients reduce the number of times that they are transferred kind of around the office?
Yeah, no, that's an awesome question. A lot of times to our nursing clinical team, we get calls for billing, we get calls for financial, new patient consultations, things that we wish we had control over, but unfortunately we just don't. So if you know that you need to pay a bill or talk to a financial representative about cost of a procedure, if it's something like that, or if you need to schedule an appointment with one of the physicians directly, just make sure that you listen to the prompts, because there are prompts for all of those different things. There's prompts directly to our pharmacy team members who can send our prior authorizations for medication. They can send your prescriptions. They can help kind of move scripts around if you need something sent to a different place. Our phone team is more than happy to help with any script issues outside of office hours. But if the office is open and those prompts are available, definitely feel free to use those, because that will definitely help you not to get transferred through queues and have to wait longer than needed.
Yeah, absolutely. That's a really great point. We just want to make sure that we all have the bandwidth to help where needed. And so just trying to, you've heard that so many times. Please listen carefully. Our phone prompts have changed. Yeah. But if we say that, you might want to listen carefully, just so we can make sure we're able to help you in the quickest fashion possible. Cool. All right. So kind of moving along, do our clients have a need to speak to the same nurse over and over? I feel like that's a question we get a lot. And can you kind of help highlight the ways in which that's really not necessary?
Yeah, absolutely. So I know we get very comfortable with people that we talk to throughout our cycles. There's certain people that you just vibe with, and there's certain people that you would like to help you continue your care. Unfortunately, sometimes, we have nurses that work 12-hour shifts. They're not necessarily here every day, or they have called and now they're on the phone with another patient. Maybe we can't get a hold of them. But like we started this conversation off with, all of us on this phone team are highly qualified nurses. We've been all in fertility and trained in this, trained with CNY. We know the protocols. We understand what you need. So if you miss that initial call, I know it's very tempting to want to wait and reach out to that same nurse because you want to just make sure that the plan is okay. And what I want to let you guys know is you need to just feel comfortable asking those questions to our team on the phones. Like I said before, if it's not something that I know off the top of my head, or if it's not something I can look into for you, I will certainly get you an answer by the end of the day. But don't feel like you need to wait or just speak to that one specific person again, because a lot of us are able to help you and get you the answer probably quicker than if we waited.
Absolutely. No, that's such a great point. And the one that we really want to drive home is truly and completely that. One thing I really appreciate about our what we do here in our staff is that, like Amanda said, if a certain nurse, if I don't know the answer, I'm not going to tell you that I do know. I'm going to ask Amanda. I'm going to check with somebody who does know. And we really all pride ourselves on that ability to give you that accurate information because we know how much you have at stake here. We know how much money and time and how much emotional capital you all spend to get to your end goal of being a mother. And so rest assured that we really are all in this together. So not just Amanda and I and our two teams, but all of you as well. And so that's a great point. You kind of mentioned this briefly, but can you touch on it again, the kind of the callback feature, or if a voicemail is left, what the expectations are?
Yeah, of course. So first off, if you leave us your information, sometimes I know we get very worked up and we're nervous and we leave a message and you forget to leave your name or your phone number or a birthday. So, sometimes as long as you leave detailed information about what you need, a good contact number to get back in touch with you. For the callback feature, you can leave your phone number just through pressing buttons on the phone. But if you don't leave a message, if something happens, it's technology and sometimes these things fail. But unless we have your information, sometimes we don't know how to get back in touch with you or who was the caller. So if you leave us either via voicemail or on that callback feature, just a little bit about you and what you need, your name, date of birth, you will get a call back, or at least whatever, concern that you had or thing that you needed, we'll start, we get that right into motion that same day. So maybe you need to schedule a consultation. You hit our line on accident. We might not call you right back because we can't schedule those for you, but we will put the ball in motion to get you to the call center and have somebody give you a call back as soon as possible.
Yeah, that's perfect. That's such a great point too. Sometimes just because you haven't heard back from us, many times if it is something that one of our specific teams can't handle, or potentially it is something that maybe only the travel team can handle. And I can't think of too many instances or situations where it's something that only we can handle. But sometimes it's just a matter of getting a message to the right person in the right department so that we can get you the answers you need without delay. So,
Yeah.
Well, we've talked about a lot of the ways that we are one team and that we are able to work together, but I know there are some differences too. So how would you say the Global Connect phone team differs from the travel team?
So there's not many ways that we really differ here at CNY, whether we're in the office, whether we're on the Global Connect team, pharmacy team, travel team. Our main goal is to get you pregnant, to help you through this process. So there's not too many ways that we're really different. What I could say is that when results are received, whereas Elizabeth's team can go ahead and read those results, process them, make your plan, we don't necessarily on the phone team have the ability to make that initial plan. If that plan has been put in place, it's in your portal, and we have that available to us because all of your results have been received, reviewed, and a plan has been deemed appropriate for you. We can certainly go over all of that, make sure you have all the medications needed. We can discuss your lab results with you. We do understand that whole part of things. We just, the only thing I would say we can't do is make that initial plan for you. So once the travel team gets your results, as long as we get them those same day, usually the travel team is in contact with you. And if you miss the call, just call back and our team can help you from there.
Yeah, absolutely. And that's such a great point. If the travel team has called and left you a message, then that plan is in. We've released those instructions to you. And so feel free, like I said before, if you miss our call, please don't fret. That's why we're here. That's why Amanda's team is here till 8 p.m. because we know, like I said, that you all have lives and other things to attend to. And so if you do miss our call, just know, rest assured that you can call back as late as 8 p.m. Eastern, and any one of the nurses on the Connect team can help clarify the plan or answer any questions that you have. It just sometimes comes down to if a plan needs to be changed, or if we were unsure on what the plan was going to be and the travel team maybe needs to access a provider to determine what might be the correct route to go. That's a situation where the Connect team might say, I'm so sorry, let me clarify that with the travel team and have them call you back.
Awesome. Yeah.
Yeah.
That's fair.
Awesome. Yeah. So I think we've sort of touched on this, but help me understand why it might not be beneficial for a client to request to only speak with a specific nurse.
Yeah, so we did touch on it a little bit. So I myself, I am in the office Monday through Friday, some Saturdays, and there's a good handful of us, I would say, with those similar hours. But as I mentioned before, because our team functions from early morning, sometimes as early as 5 or 6 a.m. until, about 8 p.m. or possibly later if we're still obtaining results. Some of our nurses and providers do not work every day of the week. So if we're holding out, trying to wait for that one person, or if they are in the office, and they're kind of working through their list, instead of being that 8:30 p.m. call after hours, if we can go ahead and help answer your questions, or at least kind of, put it in the right direction if it's not something that we can do, that just gets you that answer quicker, because we don't want you to have to wait until the end of that nurse's day or until a day or two later when they come back, if it is one of those situations that they're not Monday through Friday, which happens.
Yeah. Yeah. Just to add to that, I do get that question a lot that, how do I get you directly? How can I just work with you only? And as much as I think so many of us, all of us probably wish we could continue to follow a specific client's journey and, work exclusively with that client, because we don't all work the same days each week, or we don't all work every day of the week. What ends up happening, and what we've found, and it's kind of why we've designed it the way we have, is that it delays your care. It definitely delays your care. So there's been plenty of times, I typically don't work on Wednesdays. And so there will be plenty of times that I'll come in on Thursday and notice some messages that were sent to me only. And I feel terrible that I wasn't able to get to those in a timely manner. And I think that the end kind of point is just that we are all here and highly capable. And yes, we definitely respect that, certain people drive, kind of like Amanda said earlier. And, we would love it. You would love it. But in order to kind of operate within the way we have things structured, you really will always get the quickest response if you're willing to trust the nurse that is there to help you. And I think a good point to make is that Dr. Kiltz and all of the leadership here at CNY Fertility take very seriously the people that we have here, the nurses and the staff that we have here to help you. And we want to make sure that you are getting the highest quality of care. So very, very good point.
Just to add to that real quick too.
Of course.
Our team, the Global Connect phone team, is in direct contact all day with the travel team. So, although we might not be able to get you Elizabeth, if you had a specific question for her, if you're asking the question to me and it's not something that I think I might know, we have communication directly where I can shoot her a quick message right while I'm on the phone with you. A lot of times she'll get back to me really quick and I'll be able to just provide you the answer. So if it's something specific like that, just rest assured that we do have the means and resources to reach out directly to that nurse that you're looking for. We can't always guarantee that we're going to get you on the phone with them, but we can certainly at least kind of bridge that communication gap so that, like Elizabeth said, you do get that answer a lot quicker.
Yeah, absolutely. That's such a great point. Somebody asked a question a few minutes ago, but I really want to answer it so that we don't forget, because this is a question we get a lot. And this is the question here. I put it on the screen. Do we need to tell the team the night before our appointments? What's your best answer to that, Amanda?
So if you can tell us the night before, like we were saying, we're here until 8 p.m. Eastern Standard Time. That is going to ensure that you guys get results the next day. If we don't know that you're going for monitoring until we get those results in, it's going to just delay your care a little bit because then we're tracking down missing results. We've gotten results. We don't know exactly what your plan is or what your kind of goal moving forward is. So if you can at least let us know either via portal message or give the phone team a call, we're more than happy to get you on the schedule, get you the lab slips that you need. And then that way you are assigned a nurse and you know that you're going to get an answer that next day.
Yeah, absolutely. And just a little more on that. Our team, and I've talked about this here before, but what we do is the night before the following day, we look at all of the clients that are scheduled for something, ultrasound labs and whatnot the following day. And then we assign you a nurse. And so you have a nurse that's actually looking through your chart, usually the night before or very early the day of, and investigating your journey up to this point and the plan as put forth by the provider. And that nurse then has you on her radar to be looking for those results, be anticipating what the plan is going to be after it's reviewed. And so if we don't know that you're going, then that kind of puts us behind the 8 ball. Mm-hmm. And that puts us in a position where we're kind of scrambling to get a nurse to assign to that results and that set of instructions. And it just puts you at an overall disadvantage because you don't have the luxury of a nurse who has been able to truly investigate your entire journey and make sure that the plan is as it's supposed to be. And so really, really, truly so important. Like Amanda said too, maybe the travel team advised that you need to go back on Friday and you've called your monitoring center and they can't accommodate you Friday. No problem. Almost always we're able to shift appointments by a day or two, but we can't do that if we don't know that's what you need to do. And so I think it's always better to over communicate those things rather than to under communicate, because then we can kind of all be on the same page. Yeah. So that's anytime you have, you have a question or you need to change something, or when in doubt, just communicate. Quick message through the patient portal. And also kind of bridging that or on that topic is, if you're going to go to a facility that's different than your usual, be sure to let us know. And that's something I don't really think requires a phone call. You can absolutely message through the patient portal to the travel team and just say, hey, heads up, I'm going to go to this facility instead of my normal. And you might also get a message the night before because we are always preparing for that next day. And so you might get a message that says, hey, where are you going tomorrow? And even if it's your same old place, that's that over communication part, because sometimes we don't know and we assume, and we're calling that facility all day, and then lo and behold, you didn't even go there because they were full. And so again, that whole kind of over communicate is always preferred. All right. So next question that I had for you is why can't clients specifically get in touch with like billing, andrology, embryology? Can you kind of explain some of the nuances behind that?
Yeah, of course. So now that we are getting, expanding so much and we have different offices in different time zones, we do get people who are calling us maybe after hours. So after that 4 p.m. Eastern Standard Zone timeframe, looking to speak with billing or the call center or, one of those other facilities outside of the nursing or clinical team. They typically are in office 7:30 a.m. Eastern Standard Time to 4 p.m. Eastern Standard Time. So outside of that, if you need to pay a bill, if you are looking for more financial, assistance rather than what you see on the website, because there is a ton of great resources in regards to financial and traveling and a bunch of that stuff right on the website, which I always try and tell people to go back and refer to, but for us, knowing that you've just held for 25 minutes and that department is no longer here, it makes us feel terrible too.
Yeah.
So, just keeping in mind that, especially for our people over on the West Coast, just calling a little bit earlier in the day to ensure that that department is still here. And then that way your questions get answered. And it's not something that we, either have to have somebody call you back in a day or two or advise you to call, the following business day.
Yeah, that's such a good point too. And I think kind of pigtailing on that a little bit, also keep in mind that the travel team, so really the Global Connect team and the travel team, we're really the only teams that kind of operate outside those 7 a.m. or 7:30 to 4 kind of hours. So yeah, absolutely. If we're getting in touch with us after those hours, that we might have some limitations in terms of answering that specific question. But again, we're always going to make sure that we involve the right people in the right departments to get you an answer, quickly to your question. So, well, as much as we try to do well and to do right, we know that we're not perfect. And we know that there are areas in which we can definitely improve. And so how is the Global Connect team specifically working on better serving our clients?
Yeah. So one of the things that I think I mentioned earlier is we have about 17 nurses right now that make up our phone team. So when you guys are calling in, those are the nurses that are available to you. So what we're doing now, because we know that you guys have been awesome and so patient with us with, extended hold times on especially Mondays and Fridays, trying to get in, calls on the weekends, things like that. So we've actually are in the process of adding 4 new nurses to our team. So they are training now right in our Albany office. So what we're going to be trying to do is staff these phones a little bit better and more appropriately so that you guys that are calling in on a Monday are going to have a better chance at getting a live person, not having to necessarily leave a message, and just kind of opening the communication a little bit more between ourselves and other parts of the team. So that's another reason I'm really happy to be here with Elizabeth today, just to tell you a little bit kind of about what we're doing and how we hope to help. And we're always, of course, welcome to any suggestions.
Yeah, no, absolutely. This is a great question that I feel like is really relevant at the moment. So Jessica mentions that she thinks, and this is so great. And I was actually going to kind of put you on the spot and ask you about this, but she's absolutely right. She's basically saying it's tough. How do I know if I'm waiting on a call till 5? How do I know my provider sent the information out besides calling to see if it was received? So I know I'm putting you on the spot, but any wisdom on that one? Because I know that is kind of a tough spot and you guys do get a lot of calls. Have my results been received?
Yeah, definitely. So we've actually been working with our call center team too. So if you guys listen to the prompts just within the last week or so, we've actually added in our welcome message when you call in an option for providers to have access to our fax number. So it's just another way that they can have our fax number. So if they're calling or if you're calling and you can't get through and you just don't know if your results are here, it's never, ever, ever going to be a bad idea to just listen through that prompt, grab that fax number, and have them refax the results. Having them more than once is never going to be a bad thing. And then another thing that I will say is even if we don't have results, keep an eye on your portal. We typically will get results in if it's a case where we need to make a decision with your treatment plan, or a case where, it's something that we can maybe hold off until the next day when the results come in. We usually will call you, or the travel team will let you know in the portal, hey, listen, we didn't get this yet. We're going to still keep an eye out for it this evening. If it doesn't come in, though, this is what we want you to do. So I think just keeping in mind that even though we have maybe not reached out to you by 5 p.m., you're still on the list, you're on the radar, you're going to get some type of direction that takes you into the next day. So what I would say is just sit tight. You can always have them resend it to us. It's never going to hurt anything. And we hope that prompt will help your facilities too when they call in, so that they can just directly fax straight to us.
Yeah, and I think one thing that's really important to note is you can actually check in your patient portal. If you click on, I believe it says like patient schedule or something of that nature, you can see that you're scheduled. Now, we get this question a lot. It'll say Syracuse, and people will say, "Oh my goodness, aren't you aware that I'm a travel patient?" But that's that placeholder appointment that goes on the global travel schedule so that you can be assigned a nurse to your care. So if you look on your patient portal and you see appointments for that day, rest assured you are going to get a call. It's only, I think what's most important to know is if we don't know you're going, or you're not sure we know, or you look. So another thing is maybe we've given you an order to go back on Friday, but you look in your patient portal and you don't see Friday listed, let us know. We're not perfect. So we have to physically schedule you on our outpatient schedule so that we essentially have you on our radar. And so if you look on your patient schedule and you see June 7th and you see global travel, or I think it's, I forget what it says, but if you see an appointment for the day you're going, rest assured. You know, I know there's a lot of days where, you know, the later the results come in, sometimes I'm calling clients with their plan at 5:30 or 5:45, and I know it gets nerve wracking. But if you see that appointment listed for today, you can rest assured you're going to get a call. If you ever don't see that appointment listed, that's a great time to either give a call in, especially if it's getting later in the day, or if it's early in the day or the night before, and you know we've told you to go tomorrow, but you don't see it on the schedule. Just let us know. Like I said, there's times where we get busy and we might change dates around or something. But if that doesn't physically get put on the travel schedule, then that might be a situation where we don't know that you're waiting for us to call you because you're not on the schedule. So,
and another question we get sometimes too is when you see yourself on that travel schedule at, you know, say 12:30 p.m., 1 p.m., that does not mean that that's the time that you're going to get the call. That's just your placeholder in the day so that we know that you need a call by the end of that day. So if, you know, 2 o'clock passes and your scheduled time on the travel schedule was 2 o'clock and you haven't heard from anybody, that's okay. You're still going to get a call. It just might be a little bit later on in the afternoon.
Yeah, thank you so much for bringing that up, because that is an excellent point. You know, two of the main questions we get about that schedule portion is one, oh my gosh, I live in Texas. You know, I'm not coming there, right? And then two, that like you said, I'm so glad you brought that up about the time. And so that time is 100% random. So all we do when we put you on our outpatient schedule, we're just choosing the next open time slot. So one day you might see your time at 6:30. Usually if you're going to be triggering or be scheduling your transfer, you might have an earlier time frame in the day. That's just a random place in line. So yeah, just know that if you do see that time and then you don't get the call by that time, that's totally normal. So that's such a good point. Excellent. Well, I think the last primary question I had for you, and then we can, you know, kind of scroll through some of the questions, but after 8 o'clock and before, is it 6 that the phone team starts? Okay. So between 8 p.m. and 6 a.m., what we do have an on-call service, an on-call nurse. Can you help give an example of what is an appropriate kind of use of the on-call nurse versus something that might be able to wait until the following day?
Yeah, absolutely. So very similar to the Global Connect team, that nurse that's on call can pretty much help with all medical-based questions. Some things that they can't do, similar to this team, is send in prior authorizations for prescriptions. We can't schedule consults at that after-hour time slot. So even if you are, you know, somebody who maybe is on the West Coast or in a different country or area, you know, just be aware of those timeframes. Again, just so that you're not wasting your valuable time calling in at night. If you start your period after 8 p.m., totally okay. You can just call the next day. If it's a Saturday night or Sunday, calling Monday or Tuesday is, again, going to be okay as long as it's within that 2 to 4 day window of when you would need your baseline appointment. So really just sticking to medical questions, medication help. We are more than happy to help. There's also really awesome video resources on the CNY Fertility website. You know, but we are more than happy to help with medical questions. Anything that kind of, you know, you're questioning, is this an emergency or is this something that I need an answer to right now? Those things, if you probably get somebody to better answer your question in the correct department if you call during that next business day. So just keeping those things in mind. Again, they're just going to save you time. We don't want you to waste your time looking for us if it's something that we know would be better addressed with a different team. And we're more than happy to coordinate with you through the Global Connect team on that.
And what would you say would be a good example or two of a reason that you should call the on-call nurse?
Yeah, if you,
because I think sometimes, not to interrupt, but I think sometimes we say, you know, we set these parameters and someone's really afraid to call, but there are some instances, which is why we have the on-call.
Exactly. And they're there for a reason. So, you know, if you need to call and it's going to make you feel better to talk to somebody, we're more than happy to talk to you about that. Any questions with symptoms, if you're having any symptoms or you had a procedure that day and you're just not feeling quite right, definitely a reason to call. Again, with the medication questions, a lot of times patients, we teach them how to do these meds. We say, watch the videos, and then you get there and it's in your hands, and it's super scary. It's very scary, the things that we make you do on your own. Things like that. If you need to reschedule appointments, that can probably wait until the next day. But anything medication related that we can help you with, anytime you're having a symptom or just not feeling well, or if you're pregnant and you're having some bleeding, those are all things that we want to know about no matter what time, just so that we can make sure that we're giving you, the best next set of actions. So we may say something like, hey, I think this sounds pretty normal, but come on in tomorrow and we'll book you an appointment in office. Or we'll say, hey, hold on a minute, this doesn't maybe seem right. Let's have you evaluated somewhere local to where you are so that we can make sure that you're okay.
Absolutely. Yeah. So if anything is truly urgent, you're concerned about symptoms, that is the really the right time, and as well as any type of trigger issues.
Correct.
And we know that many of our trigger times are in the wee hours of the morning, and things come up, so that we know that that's going to happen. But I think one thing that you can do to help yourself not be in that position, because it is stressful. If you're stuck at 12:30 in the morning, not knowing what to do, that can really be very stressful. And so just familiarizing yourself with the trigger instructions as soon as you get them, making sure you have those medications and that you're familiar with how to use them, as opposed to 12:30 in the morning when you're sleepy and you're kind of fumbling through everything. But ultimately, always reach out if it is urgent, and it's something that is time sensitive and needs an answer.
Correct.
So awesome. Cool. Well, let's answer some of folks' questions, and then we'll kind of get out of here. And there's questions from kind of all different angles here, but we'll just kind of grab them as we go. So Rachel is asking, hey everyone, my husband's having the PESA procedure tomorrow, and am I able to go in with him? Amanda, do you want to take that one, or do you want me to take it?
You can take it.
Yeah, so that one's a good question. So PESAs are performed in our sterile OR. And so as a general rule, you're able to accompany your partner into the pre-op area while we get everything ready, but he will be taken back to the sterile OR where the procedure will be performed. And so similar to if you were going in for surgery at your local hospital and your husband's not allowed, he's allowed to back to a certain point, it's kind of the same idea. And that's just us maintaining the sterility of our ORs and making sure that everybody, that it's all safe. So yes, you can come into the office with him. You can sit with him before and after, but during the actual procedure, we would have you wait in probably the pre-op area or maybe the waiting room. So that's a really good question. Elizabeth is asking trigger shots tonight. Yay. And Harvest in Albany on Wednesday. So maybe you will see Amanda. Should we be aware of any side effects of dual trigger shots? And that's one I know you got. You're like, I got this one.
Right. So a trigger shot, no matter what, can, sometimes you'll feel that cramping, you might get that increased discharge. These are all things that are very normal. It totally freaks people out for very normal reasons. So you might feel a little crampy, you might feel a little bloated, but really when we use that Lupron trigger shot in combination with the HCG, it really gives you a super, super great response in terms of being able to help you to ovulate at that time we want you to, without necessarily sending your body too far overboard. The Lupron's really, really good at helping to kind of keep things in line and in check, whereas sometimes that HCG alone, if your levels aren't appropriate, can sometimes get you in a little bit different of a situation. So some bloating, some cramping, some increased discharge, discomfort, all can be very normal and things to expect. And I wish you the best on your retrieval Wednesday. Hope to see you.
Yeah, absolutely. This is a question I think, Amanda, we all get quite a bit. And this one's from Danielle, where she says, can you find us a clinic if we're out of state? I can't find one, and it's making not be able to do, I'm guessing she means IVF with you guys.
Yeah.
What's your advice there?
So we have it, again, back to the website. I'm telling you, it's awesome on there.
It really is.
Yeah, we have a travel page specifically for those patients that are coming from out of state or are traveling to our facility for treatment. Right on there, we have a nice interactive map that has different pinpoints, not necessarily all CNY facilities, but they're facilities that our patients have used in the past. We've received results from them in a timely fashion. They've worked for our patients have worked with them. So those are always options to kind of go through. If you can't find somewhere on that map that's pretty close to you that can do blood work and ultrasound, we usually recommend that you start with your OB/GYN. A lot of times they can, if not perform the testing for you, they will know some different resources that perform this, fertility testing local to where you are. The blood work is a lot easier. You can go to a LabCorp, you can go to a Quest, a local hospital outpatient lab, as long as they can get us results that day, totally fine. But we do know that the imaging can sometimes pose a problem. So your OBGYN, a local radiology outpatient department, some people go to local hospitals. But if you ask, I promise you that somebody around you will at least have an answer if they can't do it themselves.
Yeah, and that's the really great point is everywhere you call is certainly not going to be able to help you necessarily, but what we have found most of the time is that if they cannot help you, just take that one step further and ask, do you know anybody who might be able to perform this testing?
Yeah.
And typically, because I know a lot of clients will say, okay, do you know anywhere in Westminster, Maryland? And I'll say, well, no, not specifically, because we do service clients from all across the United States, Canada, and lots of different countries. It would be impossible for us to keep track of every single facility. However, you can kind of use that affiliate monitoring map that's on the CNY website as a jumping off point. Because again, maybe it's outside of driving distance from you, but you can call that facility and say, would you happen to know anywhere in my area? But usually starting with a local OBGYN, an outpatient radiology clinic at a hospital, or a standalone diagnostic imaging facility. With those three places, usually you're going to have some luck in finding somewhere that's going to be able to help. All right, next question. Let's see here. I know there's been a couple questions about urology, and unfortunately, Amanda and I both probably aren't the best to answer those questions. So if you have been waiting for a little while to hear back, please feel free to call. We can send another message over to their team. I do know that they are a very busy team, as we all are. And so, feel free to continue to kind of over communicate until you get those answers. Do you have anything to add to that?
Yeah, their time out right now for booking urology procedures in Syracuse. From the time you call us and we initiate that contact, it's about 2 weeks right now that they're booking out. We do have a urologist that comes right into the Syracuse office. We work with him all the time. It's Dr. Trussell, but he does have another practice too. So we kind of see when we can get you in with us versus at that practice, because we all kind of work together to make sure we get you that quickest appointment. But I would give it about 2 weeks from the first time that you call in to get that appointment scheduled.
Perfect. Yeah, I think that's absolutely accurate. They really, I think it is important to just have those expectations of understanding that some of our departments are they're highly sought after. And so in order to give each client the safe, appropriate care that they deserve and that we want, sometimes those wait times are a little bit longer than maybe some of us would like. All right, this is a really good question from Ariana. She's just asking, I'm a travel patient for Syracuse. Who do I contact if I have a question about my protocol? Do you want to take that one?
Yeah, of course. So back to kind of what we initially started with, protocol questions when you're monitoring through our global travel team are going to go to the global travel questions tab. So if you're going through the patient portal and you have questions about your specific protocol, not necessarily like an office procedure. So if you have questions the day before your retrieval about, maybe who can go in with you or something like that, that's definitely something that the office staff can help with. But if you're looking for information about your initial protocol or to see if your labs have been received, or if you're looking to add or change or alter something, that would be a time to reach directly out to that travel questions spot in your patient portal. They'll be able to get you the best answer to those questions.
Yeah, and on that as well, sometimes or most of the time, about 95% of the time, any type of protocol changes do have to be approved by a provider. And so because, we are all highly engaged in the different areas and avenues in which we work, our providers are as well. So our providers are doing new patient consultations. They're doing follow-up talks. They're doing IUIs, SHGs, HSGs, transfers, retrievals, you name it. And so if you call in wanting to talk about a protocol change or something of that nature, the chances of us being able to get a provider on the line in that moment are pretty slim. And so I would highly, highly recommend that you send a protocol, unless it's urgent, of course, but sending those kind of protocol change or protocol questions directly to the global travel team, because what that allows us to do is to actually consult with a provider on your behalf and develop, what those changes are. Now, if they're big changes, oftentimes that's going to necessitate a call with the provider, but where we can, can, we're absolutely able to consult with a provider about a quick change. But on the likelihood of us being able to facilitate that while you're on the phone are probably a lot smaller. And so that would be a perfect opportunity to directly message the travel team through the patient portal, so that you can get the most appropriate response to your question in a timely fashion. So this one isn't necessarily a question, but I know I feed off of and appreciate compliments and all of your gratitude. And so Samantha says, I love Nurse Amanda. She's so sweet and always takes care of all my needs in a timely manner. When I message her, she's the best. So happy to have her. Oh, she must have met you in the Atlanta office.
So I was down in Atlanta helping their office a little bit, and I did meet Samantha. So it's so nice we have such amazing patients, and we have the flexibility to be able to talk to you guys from all over the country, all over the world. We are truly lucky. So I definitely appreciate that, Samantha. Thank you.
And we truly are. I try to emphasize that in all the calls. And, a lot of times people ask to speak directly to me. We talked about this a little bit earlier. And what I really have to say is, I'll always help you if I can, but you really, and I say this a lot on these lives, but the group of nurses that are here at CNY Fertility truly are, and it chokes me up sometimes because we truly are such a passionate and dedicated group of nurses. I never before in my nursing career have worked with such amazing nurses. And so we really appreciate those kind words, because we really do pour our hearts and souls into every case, every call, every plan that we put in. And so it's always nice and appreciated to hear that positive feedback. All right. So Kayla is asking, and this is a good question that I think we get a lot. So she's asking, after we do our frozen embryo transfer, when are the ultrasounds? And so I'll start, and then you can kind of pitch in if you have anything. But usually what happens is after your frozen embryo transfer, about 10 days later, you're going to go for a blood pregnancy test. If that is positive, then you're going to go back 20 or 48 hours later, so 2 days later, for a repeat blood test. And as long as that is rising appropriately, you can expect your first ultrasound to be about a week from that second beta. And so if you're kind of in your mind, if you've come to transfer, you have your orders for your midway bloods and you have your orders for your beta, you can expect about 10 days after your first beta approximately is going to be that first ultrasound. So that's an excellent question. This is a good question that I feel like we get, and we're going to expand on it even a little bit, but we get a lot of questions. Amanda's team gets a lot of questions about, well, why am I triggering with this? Or why does this person have these trigger instructions and I don't? So your question, Nanu, is when an estrogen less than 2000, can I trigger only with Pregnol? Well, that depends very highly on a whole bunch of other pieces of data. And so we pride ourselves here at CNY Fertility on taking each individual case, all of the data that we have about that case, and making a determination. So unfortunately, I can't, or Amanda's team can't, if you call, say, well, yes, based on that estrogen level alone, we can't really say, because there's a lot of different pieces of information and data that go into making a decision on a trigger. And that's kind of what you have, for lack of a better word, you've hired us for, is to analyze and crunch that data and make sure that you do get the most appropriate trigger instructions possible for your age. Do you have anything to add to that? Because I feel like we do get this question on triggers a lot.
We do, yeah. And I guess to add to that, our doctors are super, super detailed when they put these plans in for you guys. So a lot of times too, what we'll see in your plan is, if estrogen is above or below this, then this is going to be the trigger plan. And again, like Elizabeth was saying, it goes off of a lot more things than just your estrogen or how many follicles you have. We really look at your age, your AMH level, what you've done in the past, how you've responded to in the past, to the meds that you're on, because those meds can alter your estrogen levels. So it's really hard to base it just off that. But just like she said, rest assured that when we do give you that plan, it's because we've seen all the pieces together, and we're giving you what is going to be best, feeling wise, and then of course retrieval wise, to kind of get you that best response.
Yeah, and just one really quick add on to that. The team and my team, we all get a ton is the package says I should take this Lupron trigger 12 hours later, but my instructions don't indicate that. So just know that if it does say that, you're always welcome to ask, because we are not infallible. We are human and mistakes happen. But for the most part, if you get instructions that include some HCG, you're very likely going to see one Lupron trigger. And so I think the overarching take home here is to always follow the written instructions that have been released to you. And obviously, if those written instructions don't look correct or you have a question, please let us know. That's what we're here for. But do know that there's going to be plenty of instances where the label on the medication itself may not match what the actual instructions are. And that comes down once again to our desire to highly specialize each individual plan to you as a person. And so the bottle of estrogen might say to take it vaginally twice a day, but your instructions might just say to take it 3 times a day or to take it orally and vaginally. But that's because your nurse has read the plan from your provider and synthesized all of the information to make sure that that is in fact going to be your best bet. So I think we get that question a lot, and it can be really nerve-wracking, but just know that those written instructions kind of always are going to trump what's on the package.
Perfect.
So awesome. Let's pick another question here. Somebody has a question about Healing Arts. Yeah, definitely reach out to Healing Arts directly. In the portal, I received a message back. Do they recommend acupuncture? Yeah, that's a good question. Do you happen to know, Amanda, about acupuncture in Buffalo? That's up and running, right?
Yeah, so they have a acupuncturist that they refer out to. So it's not going to be right in the CNY office. But if you shoot me a message right on the portal, I do have it on the other computer. I can certainly send you their number.
Awesome.
They offer the same rates as CNY. So you'd be, kind of right in the same ballpark, and they're very close to the office there in Buffalo. We just don't have a direct provider for acupuncture in that office right now.
Yeah. And that's the case, I believe, for Colorado, Buffalo, and Atlanta, right? Yeah. There's not but we do have, because we rely so heavily and we feel so strongly about incorporating Eastern medicine into what we do here, we do have options in each of the locations to help you out if we don't have in-house. So that's a really good question. All right. We have time for maybe a couple more questions. Let's see here. I mean, this is more of a provider question, and where our faces are going to get hidden here. But Courtney said I'm just going to take this off the screen, but she said she had a DNC with her 5th loss, and I'm so sorry to hear that. It sounds like you did get the products of conception tested and opted to do some PGT with your embryos. The question basically is, do we assume if one pregnancy ended due to chromosomal abnormalities that all 5 of my pregnancies were the same? Definitely not. So I think it's a really important thing to consider that we all make abnormal embryos. Mm-hmm. So whether you're 25, 35, 45, obviously the percentage of abnormals is going to increase with increased age. But no, I don't believe that would be something to say firmly. We know that each pregnancy has its own sort of set of success rates. And so that's kind of, the long and short of that. IVF does not lower the chances of chromosomal abnormalities. In IVF, you just have the ability to test for them. So whether you test or you don't test, you're still going to have abnormal embryos probably in there somewhere. And some people are very blessed to have 4 embryos and all 4 are normal, but it is really very normal for embryos to test abnormal, no matter what your age is. And so I would just encourage you not to become discouraged by that. So that's really all the questions we have. Amanda, do you have anything additional to add or anything else for tonight?
Well, no, I just want to thank you guys for allowing me to come on and introduce myself and our phone team. And, if there's anything that we can do for you, like we've been, chatting about all day, we are a team. We're all here for you. You guys make this happen for us every single day. We get to come to work and do what we love. So just thank you all. And if there's anything else that I can personally do for you, feel free to let me know.
Yeah, absolutely. And really the take home is that we all are here as one team with one goal, which is to help you get pregnant. And so we really appreciate you allowing us to be a part of that journey. So for tonight, we'll say good night. We'll see you next week. I believe we'll be doing the 7 o'clock Eastern time, maybe over the course of the summer. So hopefully that time works for people. And once again, feel free if you've got a different topic ideas for or different people that you want to see. That was kind of the overarching theme from a lot of the commentary, was that people wanted to talk to Amanda and her team, and they wanted to talk to embryology and healing arts. And so if you've got other groups that you would like some FaceTime with here, definitely let me know by dropping that information in the comments, or topics for future live feeds. But until next week, truly thank you all for letting us be a part of your journey, and have a good night. See ya.